Hi, I'm Rachel Wall, founder of InspiredHygiene.com, and today we're going to be revealing trait number 2 of Rock Star Hygienists. We've been doing a series on this based on and inspired by the hygienists that we've had the privilege to work with over the last year. And one thing that we know about Rock Star Hygienists is that they are always prepared for their patient before they ever see them in the operatory. So if you're a Rock Star Hygienist, you know what this means is you've learned as much as possible about your patient before bringing them back in the operatory so that you have a very clear idea and a plan of action of where you're going to go with that patient. So, things change. You may have had a plan to represent treatment on the upper right, but when the patient sits down, they're having a problem with number 30, and so obviously you're going to address that area. But it's so important to have a very clear system and checklist that you use to review your charts and prepare for your patients. This is a key component to time management. So, you're not going to be running all over the place looking for the sensor or a Prophy Jet tip once you've sat down with the patient. A key component to patient confidence, feeling like you are a very experienced and competent hygienist. Self-confidence, and also it's a key component to enrollment success in delivering ideal patient care. Now, I've noticed, even in the transition I've seen in the practice where I still do hygiene, going from paper to paperless is we don't have that paper chart in our hands, and so it's a lot easier to overlook important information. So that's why having a checklist is so helpful. And so I'm going to give you the opportunity to download this. If you'll go to inspiredhygiene.com/chart review, inspiredhygiene.com/chart review, you can download this, and this is just a starting point for you. You will probably have things that you want to add to this or things you want to modify, but it's nice having a checklist so every day when you go through all your charts, you can make notes. Either here, each patient has one, or on the schedule, or wherever it is that you want to note it. So let's just go through a couple of the things that you're going to want to look for. I mean, obviously you're going to want to look at their perio status and the date of their last perio exam. So let's say you have a standard of care that you do a complete A to Z periodontal charting once a year. Then you're going to make sure that you look at their last perio exam and make sure that you know if that's something you're going to be doing today. You're also going to be looking at the date of their last radiographs, and if they're due for x-rays, then you want to make sure that you've got that sensor in your room, it's plugged in, it's covered with a protective sleeve, so that as soon as you do your medical history review and kind of chat with your patient, if they need x-rays, you can just get it started right away. Now, ideally, when you're pre-appointing and you're making the next appointment, make sure if they're due for x-rays the next appointment, you put it into the appointment. But, we know that that doesn't always happen, so making sure you check ahead is going to save you a lot of time. The other thing you want to look at is outstanding treatment and any intraoral photos that you've taken of outstanding treatment in the past or that need to be taken. So this is where doctors, you really come into play, is your ability to do a comprehensive kind of full treatment plan at some point with that patient is going to make it so much easier for your hygienist to tee up the next section of treatment for your patients before you come in for your exam. So that creates a roadmap for them, and putting that into your clinical computer chart. So, a lot of folks have the software, whether it's Dentrix or EagleSoft or PracticeWorks or Curve, but they're not using the clinical charting piece, and that is so important because you can easily see your path of treatment. So you can see the upper right and the upper left have been completed, and maybe lower right is the next sequenced section. So your hygienist can look and make sure that's still the most urgent, and then they can represent that. And they also know, hey, if I don't have an existing photo of that lower right, or if something's changed in that area, I need to take a picture. So that's the other thing you can prepare for, is you can have your intraoral camera plugged in and ready to go when you know you're going to be presenting restorative treatment again. You also are going to want to look at notes from previous visits. So let's say they had a crown placed a couple months ago since your last hygiene visit. It's really important to ask them and say, how's that crown feeling that we did on number 30? And even if they do need maybe a bite adjustment, how much better is it that you were proactive and asked them than them having to bring up the fact that maybe that crown isn't feeling quite right. So you just think about all the things you can do when you've prepared and how you can just flow through your appointment, and it really helps with time management and developing that real strong relationship with your patients. Also between the dentist and the hygienist, because when the dentist walks in, the hygienist is prepared and we know as much information as possible about this patient. The other thing you're going to look at is, maybe personal notes. Did their daughter get married last month? And you want to ask them about that. Did they go on a big trip? Or, what else is there that we need to know? Are there any notes from specialists and things that we want to ask about? Maybe they're going through implant treatment, and what stage are they in? So again, I've got this checklist for you as a starting point. And having this is really going to help your appointments flow. It's going to help you be ready to go, manage your time better, and you will be a rock star hygienist because you'll be completely prepared. So remember to download this checklist. Just go to www.inspiredhygiene.com/chart review. I'll see you next time. I'm Rachel Wall, founder of inspiredhygiene.com.